Hey there, this is Dr. Whalen. This is video number 2 in my video series that I'm starting. I wanted to tell a story that could maybe illustrate something about me. Ultimately, if you guys are going to be tuning into my videos to trust my advice about medical stuff, you might want to get a sense of who I am. Touched on some of the logistics in the first video where I said went to the University of North Carolina for med school, University of Utah for residency, but those are just facts. In order to get a sense of who I am and what I'm about, I thought maybe this story would get closer to the point. So yeah, I'm a doctor. If you want to know what it's like to go to medical school, here's a good analogy. Go to something like the Metropolitan Museum of Art or the Louvre in Paris, one of these giant museums, and then start jogging. Run right through from room to room to room, look at the paintings and absorb as much as you can, look at the sculptures, etc., race right through, and when you get to the exit, take a test. Okay, good luck. You know, I am a doctor. I'm a good doctor, not great. I have the experience now to really know what I'm doing, but that wasn't always the case when I graduated from med school. I felt like I had just sprinted through, you know, the Metropolitan Museum of Art. I had a whole jumble of facts in my head. Nothing was formed. It was all gray and goofy. So I didn't really know what I was doing. Felt nervous, scared. Didn't feel like anything had really formed just yet. So anyway, at the end of my first year of med school, I was especially nervous. You know, am I going to be a good doctor? Am I going to be good enough? And now, well, between the first and second years of med school, you get your last time off before it's just immersed in work. And so during my last summer free between first and second year of med school, I had the option. I could have taken a job somewhere and made some money. I could have done any number of things. I could have done something fun, you know, go be a bartender at Club Med, who knows. But what I ended up doing was, you know, typical of me. I got a position, unpaying position, of course, working in the Navajo Indian Reservation. The hospital where I worked took me in. I got free food in the cafeteria. I got a free cot in basically a little shack out back. Basically just a bed and a bathroom and a sink. I was totally cozy, no complaints. But and what I got in return for my presence there was a lot of experience. The people really took me in, made me feel at home. The doctors and nurses were amazing. And as I was kind of the new kid in town, everyone knew I was there. I put out the word, hey, if anyone hears about anything interesting, you know, an interesting medical case, you know, grab me, bring me in. And I was slipping into this, you know, comfortable shtick there, you know, getting to know everybody, and everything was kind of grooving along. And then, you know, they say, there's a saying that life begins at the end of your comfort zone, and I was feeling comfortable there when all of a sudden one day everything changed. I was walking down the hall, I think it was like a lunch hour, and I hear the PA overhead say, Dr. Whalen, please report to the operating room, stat. Now, I thought, what are the chances? My name's Tom Whalen, but I'm not a doctor. I'm between the first and second years of med school. They must mean some other person, not me. I'm not Dr. Whalen. But I couldn't get over the coincidence how many Whalens are there out in, you know, New Mexico. So I thought, well, I'll go to the operating room and just see. Why not? It's not like I had anything to do. Strolled up to the operating room, and a nurse apparently was waiting for me. Grabbed me and just shoves me up to this scrubbing sink where a surgeon was scrubbing in fast, go. You could see there was a lot of tension in the air. And I'm like, well, I'm med student Whalen, not Dr. Whalen. And he said, we know. And he immediately starts telling me the story. He's scrubbing in for a surgery. He wants me to be part of the surgery. What we have is a woman, and I don't mean this in any derogatory way, but just simply descriptive. She was gigantic. roughly 6'5", roughly about 400 pounds, and she had come into the emergency room complaining of abdominal pain. And the doctors in the emergency room worked her up and figured out that her abdominal pain was labor. This 400-pound woman, did not know she was pregnant. It gets much worse. She was pregnant with twins. It gets worse while we're scrubbing in, and I'm mimicking what he does. He's scrubbing, and I've never done any of this before. First year of med school is just books, books, books. You don't even see a person. So now I'm scrubbing in for a surgery, and you think about it, like, put yourself in my spot. It's really, imagine like you've just graduated college, no special training, and now you're going into an operating room for an emergency surgery. You're hearing this gigantic woman, she's in labor with twins, and now we're being told that the twins are breech, which means the babies are upside down. They're feet first. Babies have to be born head first. If they go feet first, they get stuck, and it's bad. So now we have two twins. They're both feet first and cannot be delivered vaginally. They have to be delivered through C-section. It gets worse. Both twins are in severe distress. You measure distress by things like their fetal heart rate, and their fetal heart rate is way low. These babies are dying. Why are they dying? Well, it's hard to say at the moment, but the mom has a fever, okay? High fever in mom is trouble. That tells us there's probably infection inside the uterus. So these babies are dying inside the uterus, so we scrub, and I'm thinking, like, I'm like in a cold sweat, thinking, what have I gotten myself into? My God, this is crazy. We're done scrubbing, we step back from the sink, and this like cool choreographed moves. Next thing you know, I've got a gown on and I've got gloves on. And they literally just push me from behind into the operating room, where I'm just like terrified to touch anything, right? But there we go. Everyone's running all around us. There's just chaos all in the room. People are running and setting things up, adjusting the lights, and those operating lights, which are brighter than the sun. And we'll talk more about that in a minute. They're putting drapes on, they're prepping the woman. Anesthesia guy races in, and he puts gas on her, and he goes, ready, go. Which was pretty impressive. And the moment he said go, the woman is out. The surgeon takes a knife and right across her belly, and I'm just dumbfounded now. I mean, he's literally like slashed her open, and I'm just like, what is happening? This is crazy. And no time for a retractor into the wound. The surgeon takes my hands and puts my hands deep into this woman and pull. I am the retractor. That's why I'm there. I'm a human retractor. He slices through, gets down to the uterus, and he pushes my hands deep inside. Now my hands are way deep inside this woman's abdomen, gigantic woman. And I'm pulling with all my strength to get this huge load of body fat and such to pull to the side. And he reaches in and pulls up the uterus, which is gigantic because twins. He makes the incision into the uterus, and at the moment he does, just tons of amniotic fluid, but it's loaded with pus. Just comes pouring out. The babies had been basically living in a pile of pus. My head is spinning. There's blood, amniotic fluid. My arms are, elbow deep in this poor woman. I'm literally like freaking out. This just adrenaline like crazy. And the doctor reaches in and carefully separates the two babies and pulls one baby out. And he clamps the cord and he cuts it, and just as he's doing that, the pediatric team comes racing in, and he passes the baby off to the pediatric team, and all these things are happening. Meanwhile, he had taken my hands away from the fat, and I was now holding the uterus open. So my hands are fighting, holding this gigantic uterus open, which uterus is a big muscle. Doesn't hold open easy. So I'm this human retractor holding the uterus open, and everything is happening like in slow motion in my head. It's so fast it seems surreal, but and this moment I'm holding the uterus open, the light is coming in at an angle, and it's so bright that all the surface is just glaring and gleaming, and inside the uterus just looks blacker than black. And while I'm holding this uterus open, out of this deep, incredible blackness, this teeny little alien hand comes up and just grabs onto mine. And wow, 20 years later, I'm still excited about it. Anyway, it grabbed me and it held me, and you wouldn't believe the strength of newborn when it when it wants to exert that kind of strength. And I'm just mesmerized, holding the uterus open, having this hand grab me and hold me, and this connection I made. But the doctor, everything's going. He reaches in, grabs the next baby, pulls it away from me, clamp, cut, pass off to the peds team. Turns to me and just gives me this gigantic handshake, and I'm just like, I'm barely able to even think, move, breathe. I'm just dumbfounded. The babies are immediately zipped away. They turned out to be fine, but they, of course, had really bad beginning. The babies were sick and had to be life-flighted off to another hospital. We were a teeny little hospital. Oh, adrenaline slowed down, and then it's a matter of sewing up, cleaning, taking the uterus and closing it, and making sure there's no bleeding, and closing the woman up, and sewing her and stapling and things. And I was dumbfounded. I remember in that adrenaline-fueled wreckage, that awash in this blood and pus and amniotic fluid everywhere, I had this epiphany that wow, I said, I love this, right? I love everything that just happened, okay? I knew I was scared as a med student, I was scared as a young doctor. Am I doing things right? But I knew from that moment that I was doing what I loved. And because I was doing what I loved, I would become good at it, at least good in the way that I would judge good. So I would be okay. I would go back to the Metropolitan Museum of Art. I would take my tests, and I would do well enough, and I would succeed as a doctor. So here I am, 22 years later. My practice of medicine doesn't agree with everybody. Like I said in the first video, my mode of practicing medicine is really for people who want to make a change, to achieve wellness, and for those people, I'm a good doctor. For people who don't want to make changes, they hate me. But I've become the doctor I wanted to be, and I'll hopefully use some of my pearls of wisdom, some of my practical approach to medicine in the subsequent videos, where I'll hopefully help you, the viewer, get well. Okay. Next several videos will not be about me or my background. They'll be more specific to a medical topic. And hope to see you soon. Have a good day.